Good morning, everyone. I'm Dr. Harshavardhan, junior resident from AIMS. My title of the paper is Impact of Early Residential Schooling on Resilience, Coping Skills Among Children. It's a cross-sectional study from rural South India. So we'll be looking the paper overview will be background, objectives, methodology, sample methods, statistics, results, discussion, conclusion, references. So background. So it's an it's an individual's life, childhood and adolescence are stages of utmost importance as most of the growth and development completes in this age. And currently residential schools in India are gaining immense popularity among the parents and students due to its approach to the holistic development in academics and the extracurricular activities. So, and also it has enriched with technologies, experienced staff, residential schools offering mentally stimulating and sound environment for the students. So the boarding schools are affiliated with the recognized educational boards in India to offer world-class education to the students. Where with India's diverse socio-cultural fabric and differing education infrastructures, it becomes crucial to understand how early exposure to such environments affects children's psychological development, especially the resilience and the coping strategies. So the government of India has given a drafting policy to promote the education for all the students at residential schools, and they have given a Ekalavya model residential school for the scheduled tribes and the Navodaya Vidyalaya system. So, however, there are very few studies exploring the impact of residential schools on the resilience in the individuals. So, the objectives of my study. The primary objective of the study is to explore the impact of early residential schooling on the development of resilience and coping skills in the residential students. And the first objective to assess the level of resilience and the coping mechanisms among the students attending residential schools, and to identify psychosocial factors that contribute to the enhancement of resilience in these children's. Methodology. It's a cross-sectional study to assess the resilience and the coping skills of children attending residential school, and the study was included a total of 443 students, children's, which are evenly with even males and females, aged between 12 to 17 years. The inclusion criteria, children from 12 to 17 years were selected and who are enrolled in the residential school for at least 1 year and willing to participate with parental consent provided by the institution. It's a blanket consent. And the exclusion criteria, the children with the clinical diagnosis of mental health disorders and student who have been in the residential school for less than 1 year, and the day scholars are the exclusion. It's a stratified sampling method was used to ensure the proportional representation of the age groups, and the data collection. The semi-structure performer was given a 20-item questionnaire was administered to gather demographic information, academic and the psychosocial data. And procedure, ethical approval was taken from the institution, and a blanket consent was taken from the institutional head as a principal, and we have administered the questionnaires to the students, and we have maintained the anonymity and the confidentiality of the identifying informations of the students. Then the time frame, we had taken around some 2 weeks of time for giving sufficient time to all the students. Last one. So scales, we used the adolescent resilience scale, and the statistics was analyzed in SPSS. So the results, the sample included 442, where 213 were males and 229 were females, and the most students from the nuclear families, and with a small proportion, 26% with the joint families, and a significant majority of students, 97%, believed that staying in residential school helped them, where 2.3 did not helpful, and additionally 84% were happier in the company of others, where 15% of the students felt good in staying alone, and when it came to the feelings of sadness for more than 2 weeks, 30% of students reported experiencing it, while 14% of students have felt or attempted to take their life. Despite these challenges, 80% sought help when facing difficulties. And the terms overall, 52% of students has a good resilience, while 47% had poor resilience. Uh, Resilience scores did not show any significant difference between the males and females, with both the genders having the same proportions. Where the higher the classes, there was the lesser the resilience. When the lower classes has a better resilience. And the most common adversities faced by the students are exams 15%, and homesickness 12%, and loneliness so 6.7%. So, so our study found that residential schools were helpful for the participants and following a brief initial period of adjustment. And in our study, the scores for all three subdomains ranged between 0 to 20 with a mean of 14.8, standard deviation 14.8, 12.9 and 16.7 in novelty seeking, emotional regulation and positive feature orientation respectively. However, the most common coping strategies observed were making new friends, having good teacher relationships, and also increasing the hard work for studying. And it's also observed that the 30% felt sad for more than 2 weeks, and indicating the residential schools have often positive impact on the mental health of an individual. And on assessing the association between the various socio-demographic factors, it was found that class was found to be significantly associated with high resilience scores. And so conclusion, we found high levels of resilience and coping abilities in the study participants attending the residential schools. The participants were seen to develop good social behavior and learn to face the adversities with the help of friends and seniors. However, more research need to be conducted on this. Thank you.
Good morning everyone. I'm Dr. Prerna Narayanan, first year junior resident in Adi Chunchandgiri Institute of Medical Sciences, BG Nagar, Mandi. So my topic for today's paper presentation is, has the attitude on mental illness, stigma in psychiatry as a career choice among medical students changed? A comparative study a decade apart. So here's the overview of my slides. I have background, objectives, methodology, study protocol, statistical analysis or data collection, results, discussion and conclusion. So background. Over the past decade, the global perception of mental illness have shifted with increasing awareness and a growing emphasis on mental health. However, stigma surrounding psychiatry and reluctance to pursue it as a career remains challenging, particularly in India due to various cultural norms. Despite efforts to reduce stigma, limited longitudinal data from India exists to assess changes in attitudes among the medical students. This study seeks to explore evolving perception of mental illness, the stigma attached to psychiatry, and medical students' inclination towards psychiatry as a career at a tertiary hospital or a medical college, thus offering critical insights into trends over time and highlighting the need for focused education and societal reforms. So my objectives for this paper is a comparative analysis where we compare data across the decade to assess significant trends and changes and the attitude towards mental illness. That is to evaluate how perception of mental health and mental illness among our country has evolved around the years. Stigma associated with psychiatry as a career choice and factor influencing the career choice of the medical students or the fourth year students. So, methodology, my study design is a cross-sectional comparative study. Study duration is a decade apart comparing of two sets of batch of students, that is first set final year students of 2012 batch and second set is 2024 batch, that is the current batch. The study site is Adi Chunchandgiri Institute of Medical Sciences, Mandya. The subjects are 2012 final year medical students, who are 103 students have participated, and 2024 current batch of students. Criteria, all students willing to participate in the study. So, data collection. First, we collected the socio-demographic data through a semi-structured questionnaire which was given through Google Forms. Here, the data contained of based on age, gender, year of the study to provide contextual insights into the students' responses. And Google Forms were provided to access confidentiality and convenience. Informed consent was obtained in the Google form, and anonymity was maintained throughout the process. Total of 103 members from 2012 batch consisting of students studying in final year and internship participated, out of which 100 members gave the consent, and total of 98 students who gave the consent were taken from 2024, that is current batch. For both the sets, total of 98 students in each test were considered for meaningful statistics. So the scales used were the Mental Illness Clinicians Attitude Scale 2, which is a medical students version survey. This questionnaire consists of 16 items. Responses on a given were on a 5-point Likert scale ranging from strongly disagree to strongly agree. The questionnaire takes approximately 6 to 7 minutes to complete. Again, next scale, a modified questionnaire based on David Feifel's scale was used to evaluate stigma towards psychiatry and factor influencing the choice of psychiatry as a career choice. So the statistical analysis, data collection, as I previously told, 2 sets of data from 2012 and 2024 were collected. Descriptive statistics based on the age, gender, and were summarized using mean standard deviation. Inferential statistics, that is chi-square tests, were used. Significance value of p-value of less than 0.05 was maintained, and software which was used was SPSS. So coming to the results, here the x-axis consists of 2 sets of years, that is 2012 and 2024, and y-axis consists of average number of students, where the category 1 is the students of 2012 and 2 is students of 2024. V, that is the red color, consists of very much, that is strongly disagree, M is much, N is neutral, L is little, and VL is very little or strongly agree. Here, the first chart depicts the attitude towards the mental illness across 2 categories representing 2 sets of years. Red here represents the highest frequency of category 1, 2012, that is 48 students have agreed, and category 2, around 42 students have the largest proportion of individuals that the attitude disagrees, clinicians choosing psychiatry and overall psychiatry as a choice. Yellow is a frequency after red, indicating a notable group. So green also shows a smaller proportion, purple and blue represent the smallest proportion. There is a dip over the decade for the negative attitude towards psychiatry, indicating slight positive overall effect. So the second set of results, we have stigma towards psychiatry where the x-axis and y-axis remain the same. V here is very attractive, that is defines psychiatry as a career choice, very attractive. A is attractive, N is neutral, not is not attractive, E is extremely unattractive. So this chart presents data on stigma towards psychiatry and as a career across 2 categories. Red represents a small proportion in both categories, indicating that a minimal number of respondents viewed psychiatry. But over the decade, 15 students out of 98 students have responded that psychiatry is a very attractive subject. Yellow, a higher number of respondents in both categories showing moderate attractiveness or less stigma towards psychiatry. So green being the largest portion or a neutral or balanced attitude towards the stigma associated with psychiatry. This data suggests that most respondents across both categories hold neutral or moderately positive views about psychiatry as a career with minimal stigma attached. So discussion and conclusion, we have positive perceptions, that is intellectually challenging, meaningfully patient interactions, offers a work-life balance, and it has opportunities for subspecialization. And it is also a fulfilling and flexible subject. Negative perception, it has a rigorous scientific foundation and it is usually depression and frustrating field and often stigmatized. The patients are often stigmatized as being dangerous or violent. Some view it as a separate from mainstream medicine. So over the past decade, there has been a noticeable decline in stigma surrounding psychiatry among medical students, reflecting a growing awareness of mental health's importance. The shift has fostered a more positive perception of psychiatry with increasing recognition of its intellectual and clinical value. However, factors such as misconception about a scientific foundation, emotional toll, and lower perceived prestige compared to other specialists persist. Addressing these issues through enhanced education, role models, and exposure towards psychiatry during medical training is crucial for the sustained improvement. These are my references. Thank you.
Yeah. Any questions? Thank you, Dr. Prerna. Just one question for you. What are the biases that you expect in such sort of study design?
So biases is most of the medical students who are going through a mental illness, they would have a more bias towards like positive reinforcement towards psychiatry. That is, I'm suffering through it. Maybe they'll empathize more, so they'll have a bias towards psychiatry as a career. And even in the studies, sir, more number of females uh, who have a history of mental illness in the family have opted psychiatry as a career, sir. So this could be a bias.
The other sort of biases, because you're collecting data
Uh,
from persons, they
uh,
had to recollect 10 years back
yes,
their
sir.
attitude.
Huh. And the competition in the medical field, sir, like other subspecialties are often seen as uh, superior subspecialties than psychiatry, and influences from seniors or other staff, and basically that could be a bias, sir.
Thank you.
What about the exposure to psychiatry in undergraduate? Whether there was any difference?
Yes, sir. Over the years, in CBME and NMC guidelines, psychiatry have got more clinical hours over the years, sir. And the exposure to psychiatry has also increased. But again, sir, the students, due to various psychosocial factors, they consider it still as a stigmatized uh, career choice.
So based on your study,
Yes.
okay, there is one variable which could have been used, isn't it?
Yes.
Exposure
Exposure.
in psychiatry, how much it has influenced their attitude
Yes.
and choice. Thank you. Thank you.
Thank you, Dr. Prerna. I would like to call Dr. Yuki Bare. You may start.
Okay, good morning, everyone. My name is Dr. Yuki Bare, second year
No,
postgraduate. Good morning, everyone. My name is Dr. Yuki Bare, second year postgraduate from Kakatiya Medical College. The topic of my presentation today would be upon availing the emotional impact, quality of life, and depression in patients with vitiligo and psoriasis, a comparative study. The content of my presentation will be includes introduction, aim and objectives, materials and method, result, discussion, conclusion, and bibliography. Introduction. Mental and neurological disorders account for 10% of global disability adjusted life years loss, with individuals suffering from chronic conditions like vitiligo and psoriasis at a higher risk of developing mental health issues. Vitiligo is a chronic autoimmune disease that causes progressive loss of skin color, significantly impacts psychological well-being, particularly in individuals with darker skin due to the noticeable contrast of depigmented lesions. Cultural perceptions and social stigmatization further contribute to reduced quality of life and causing psychological distress, including anxiety and depression. Psoriasis is also chronic inflammatory skin disease. Disease characterized by red scaly plaques similarly affects patients' mental health. Its visible symptoms leads to feelings of unattractiveness, social isolation, and stigmatization, negatively impacting quality of life. The aims of my study is to compare the emotional impact, quality of life, and levels of depression in patients with vitiligo and psoriasis, and to assess how these conditions affect their psychological well-being. And the objectives of the study is to evaluate the overall quality of life in patients diagnosed with vitiligo and psoriasis, to assess the prevalence of and severity of depressions in both patients group, to identify and compare the psychological and emotional challenges experienced by patients with vitiligo versus psoriasis, to propose strategies for psychological support and interventions tailored to improve mental well-being in patients with chronic skin conditions like vitiligo and psoriasis. This is a cross-sectional comparative study which was conducted on a total of 200 patients, 100 patients with vitiligo and 100 patients with psoriasis, attending the dermatology clinics, both IPD and OPD patients. And the primary objective of this study was to assess the impact of these conditions on patients' quality of life and the prevalence of depressions. Participants were selected based on the following inclusion criteria: confirmed diagnosis of vitiligo or psoriasis, age between 18 and 65 years, and willingness to participate in the study. Patients with other major psychiatric or chronic medical conditions were excluded to avoid confounding factors. To evaluate quality of life, the World Health Organization Quality of Life Scale was employed to measure the aspects of well-being across 4 domains: physical health, psychological health, social relationship, and environment. The depression levels were assessed using the Hamilton Depression Rating Scale, a widely used clinical tool to quantify the severity of depressive symptoms. The data were analyzed using appropriate statistical methods to compare quality of life and depression scores between vitiligo and psoriasis patients, with subgroup analysis based on the demographic factors such as age, gender, and disease severity. Ethical approval was obtained prior to the study, and informed consent was collected from all participants. The assessment tool used for this study is a Hamilton rating scale for depression, which is a 21-item questionnaire used for assessing depression symptoms, with higher scores indicating severe depression symptoms. And the World Health Organization Quality of Life Scale, which is a scale used designed to capture how individuals perceive their own quality in the context of culture, value systems, personal goals, and concerns. It is divided into 4 domains: physical health, psychological health, social relationship, and environment. Data was entered in Microsoft Excel and was analyzed by using SPSS software, and data was calculated by chi-square test. Also, to compare to sample, data was used t-square and p-value less than 0.05, considered as significant. This study group consisted of 100 patients with vitiligo and 100 patients with psoriasis. Among the vitiligo patients, there were 60 women and 40 men with a mean age of 36.6 years and mean disease duration to 11.3 years. Among the psoriasis patients, 100 patients, 45 were male patients and 55 were female patients with a mean age of 40 years and mean disease duration to 18.6. This is a graphical figure showing the gender distribution, with blue color representing female, 60 in vitiligo patients and 55 in psoriasis patients. And this is the comparison of scores of quality of life, Hamilton Depression Rating Scale, and socio-economic status in patients with vitiligo and psoriasis. The table provides a comparative analysis of quality of life measures and depression severity between 100 patients with vitiligo and 100 patients with psoriasis. The quality of life domains include it's not going back. It's not going back.
What's not about?
Good morning all. I'm Dr. Hani from KIMS Amalapuram, Andhra Pradesh, going to present a title, a cross-sectional study to explore the association between parasocial interactions and Big Five personality traits towards K-wave and halo. Coming to the introduction, halo or a Korean wave is the term to describe diffusion and export of South Korean popular culture into the global market. It includes music, that is a K-pop, shows, K-drama, Korean cuisine, that is a K-cuisine, and cartoons, comics. So all this K-wave content has become very popular because of the song Gangnam Style and a game like show like Squid Game and a movie called as Parasite, which has bagged 4 Academy Awards. So the entry of K-pop into India can be traced back to the 90s when in the Manipur, when there was a political turmoil and there was no entertainment for those people, and they have moved towards K-pop and their K-music. So with the pandemic and also the lockdown, the importance has become more, and people have started getting into K-pop because of the efforts from Korean Culture Center India and also the Indo-Korean organization. So a fan can be described as someone who admires and supports a person or a sport, but if at all this support becomes so severe that they have a intimate conversational partner and they get deep into these celebrities, it is called as parasocial interactions. So there are many studies regarding parasocial interactions with celebrities like Michael Jackson or shows like Harry Potter, but there is very limited literature regarding this K-wave or K-pop in India. So I have chosen this study. Aim of the study is to study the parasocial interactions or relationship of fans towards K-wave celebrity. The objectives are to study the association, if any, between any big five personality traits with the K-wave parasocial interactions among youth and young adult fans, and to study the K-wave fan transportation with their Korean celebrity. The methodology, the study design, it is a cross-sectional observational study by using the convenient sampling by the online Google Forms. The sample size is 200. Tests used were Fisher exact test and Kruskal-Wallis test. Study duration is for 1 year and the statistical analysis was done by R language. The inclusion criteria is individuals between 15 to 35 years. There is no specific exclusion criteria. The questionnaires I've used are multidimensional measure of parasocial relationships with 18 questions, Big Five personality inventory with 44 questions, and transportation scale short form with 6 questions. These are all the socio-demographic details which we'll be discussing later. And coming to the table 4, there is a comparison of total MMPR scores with the K-wave related questions. And also in table 5, there is a comparison of total transportation score, and all the p-values are statistically significant. Coming to the table 6, it is a correlation between MMPR scores, Big Five inventory, and also the transportation score. Here we can see that extraversion is statistically significant with MMPR, and transportation is also statistically significant. This is the pictorial representation regarding the same. Coming to the discussion, there is a very limited data regarding this. So this study highlights some of the data. So the median age group participating in the study was 24 years and the majority was students. So this highlights that younger population have higher engagement with digital media and also the entertainment industry. So these findings are in line with a study conducted by Wong et al. And also majority of the participants were introduced to K-wave through their friends, indicating the importance of word of mouth. And YouTube was the most common platform for consuming the content, and the global studies also indicate the same. And majority of the participants binge watch their content, which highlights that engagement nature of the K-wave. And women report higher levels of affective, parasocial, cognitive domain and decisional domain, shows that there is a significant difference as well. The scores were significantly higher in females, reinforcing the pattern that women generally have more intense parasocial relationships. These findings suggest that females might experience stronger emotional connections with media figures and engage more deeply with media content on a cognitive level. And individuals who participated in online K-wave events have attempted to learn Korean language. Those who have engaged in imitation behavior such as dressing as a K-wave celebrity, and who have tried to learn the dance routines, who were involved in creating and sharing K-wave content, and have higher MMPR score and higher levels of transportation. So by doing all this, these people have a stronger emotional connection with the media content. The positive correlation between extraversion and parasocial relationships suggests that extroverted individuals are more likely to develop intense parasocial relationships. This aligns with the idea that extroverted people might be more engaged with media content and media figures, seeking out and forming stronger connections. The lack of significant correlations for openness, consciousness, agreeableness, neuroticism suggests that these traits might not have a substantial impact on parasocial relationships, or the relationships are more complex and may not be captured by simple correlations. Coming to the limitations, majority of the sample constituted of females. It could be because more K-wave content is watched by them. So this needs a little bit of exploration. There is also a positive possibility of recall bias, as these participants were asked to recollect the information. Being a cross-sectional study, the study cannot establish some of the facts which could be better understood using a qualitative study. Strengths, our study is one of the first studies regarding K-wave in India. Conclusion, this study offers insightful information on the ways that personality qualities and K-wave content consumption affect parasocial interactions among K-wave enthusiasts in India. Results show that younger population, students in particular, are very interested in digital media and entertainment, with YouTube acting as a main distribution channel for K-pop. Higher levels of emotional and cognitive engagement with media content may be the cause of this, as majority of the people participating in the study were women. Moreover, stronger parasocial ties are linked to
imitation behavior, content production, learning Korean, and actively participating in K-wave events. Additionally, the study also reveals a strong correlation between extraversion and the strength of parasocial relationships, indicating that those who are more outgoing are likely to form closer bonds with celebrities. These are my references. Thank you.
My study is on emotional intelligence and burnout in medical postgraduates. It is a cross-section study about the prevalence of emotional intelligence and burnout and correlation between them in medical postgraduates. Introduction. Emotional intelligence is a type of social intelligence that involves the ability to monitor one's own and others' emotions, to discriminate among them, and to use this information to guide one's thinking and actions. According to Goldman, emotional intelligence consists of 5 components: knowing our own emotions or self-awareness, managing them, motivating ourselves, and recognizing emotions in others, that is empathy, and handling relationships. It is a concept which began to be associated with patient-centered practice. Professionals must respond to both the technical and emotional aspects of the disease and the patients. It is the process managing their own responses and emotions too are of major priority. Emotional intelligence is a significant skill to possess by any healthcare professional. In burnout is a syndrome of emotional exhaustion, depersonalization, and reduced sense of personal accomplishment. For individual doctors who are required to spend considerable time and intensive involvement with patients and other health professionals, it is important to understand how emotional intelligence is associated with burnout. The theory of emotional intelligence assumes that individuals with higher emotional intelligence have better interpersonal and communication skills. Emotional studies have demonstrated that emotional intelligence has a positive impact on social relationships and job satisfaction. Burnout was found to be associated negative outcomes at both the individual level and at the organization level. Doctors who have achieved higher satisfaction ratings from patients may experience lesser burnout and higher levels of job satisfaction. The links between emotional intelligence, patient satisfaction, doctor burnout, and doctor's job satisfaction are still unclear. Therefore, the current study was designed to examine the correlation between the factors of emotional intelligence and factors of burnout among residents. Objectives are to evaluate difference in emotional intelligence between demographic characteristics, to assess prevalence of components of emotional intelligence and burnouts among residents, correlation between components of emotional intelligence and burnouts. Methodology: a cross-sectional study design was chosen to achieve the above mentioned objectives. Sample size calculation was done and 75 was obtained. Convenient sampling method was done. Data collected by means of circulating Google Forms among residents. Tools used were self-constructed semi-structured proforma, includes details about socio-demographic profile, work history, marital history, and so on. Emotional quotient self-assessment checklist devised by Emily Sterrett, Maslach burnout inventory. Emotional intelligence scale was adapted and it is a short form which consists of 20 scales, 20 questionnaires. A rating was given from 1 to 5. Scores on this range can be from a low of 5 to high 25. Any component scored below 18 is an area for focus. 4 components have been studied in this: self-awareness, self-management, social awareness, and relationship management. In burnout scale, it was invented by Maslach. Burnout inventory was done in 1981 by Christina and Susan E. Jackson in University of California. Consists of 3 dimensions: emotional exhaustion, depersonalization, personal accomplishment. It has 3 components wherein it includes burnout, depersonalization, and personal achievements. Where in this personal achievement, the individual assess himself negatively, represents demotivating effects due to failure situations. This aspect is due to the consequence of first two. Total of 33 or less indicates high level of burnout. 34 to 39 indicate moderate level. More than 40 indicates a low level of burnout. A higher score in the first two and a lower score in the last section may indicate higher level of burnouts. Statistical analysis. Age of the participants were mean 28. Standard deviation was 3. Genders were female 32 participants, male 22 participants. Status of marriage. Married were 38.9. Single was 61.1. Chosen specialty by choice was 70%. Chosen otherwise were 30%. Work hours were included. 12 to 18 hours were 24%, 6 to 8 hours 5.6%, 8 to 12 hours were 70%. Results. Males have, according to this study, males have low emotional intelligence in every component than females with p-value less than 0.05. Singles have low emotional intelligence than married with p-value less than 0.05. Factors of emotional intelligence indicated high emotional intelligence correlated with factor of personal accomplishments, which showed high levels with p-values less than 0.05. No other correlation was seen between emotional intelligence and burnout components. This is a table which depicts emotional intelligence prevalence. Self-awareness low percentage was 53. High was 46.3. Self-management low had 50. This was equally 50-50. Social awareness was 48% low. 51% had a high social awareness. 66% had low relationship management and 33.3 had high relationship management. Burnout prevalence was 40% had low emotional exhaustion, 38 had moderate emotional exhaustion, and 20 had higher degrees of emotional exhaustion. 13 had a low degree of depersonalization, 29 had moderate depersonalization, 57% had high depersonalization. In personal accomplishments, 42.6 had low levels, 31.5 had moderate levels of personal accomplishment, 25 had higher degrees of personal accomplishments. Discussion. Properly allotted work hours, adequate sleep hours, good relationship with colleagues and superiors determine EI and burnouts. Enhanced support system in the family, communication skill workshops, and self-experience of emotional problems contribute in building emotional intelligence. Development of emotional intelligence, having empathy and recognition of clinical anger at a postgraduate level may help to reduce burnout. The limitations were there was a reporting bias as it was collected from Google Forms and recall bias was present. The sample was taken only from the residents in one hospital, which does not include other medical professions in the same hospital and general population. Personality factors was not studied. Other demographic factors, socioeconomic factors, confounding physical and mental health issues, addiction behaviors was not included in the study. Unable to obtain projected study participants. This is my reference. Thank you. Thank you, sir.
How did you come to the samples as a 75?
Sir, convenient sampling size was done. We were about to get 80, so we took it to 75% as it was only designed for postgraduates, sir.
Sample size was calculated.
Calculated, sir.
Calculated using what? The input parameter.
Actually, it was done by my community medicine PG, but I didn't.
I'm just curious to know one more thing. You said your number of work hours 6 to 8. Which department has only 6 hours of duty?
Sir, like example, non-clinical departments,
6 hours?
dermatology departments, it is like 8 to 2 hours. They start their duty hours by 9 and finish by 2 o'clock. Few departments. Thank you.
You show the other references next. You've shown here references.
Yes, sir.
Next. That's all.
And that's all. I didn't include much.
No, you find all the references on emotional intelligence
Yeah.
and its relation to empathy and good medical practice, all that. But you are talking about correlating it with burnout.
Burnout.
Where are the references?
So I couldn't get many articles comparing both components of this burnout and emotional intelligence. I only got for emotional intelligence separately and burnout separately. So I must including burnout.
So you
more.
mentioned those burnout
Okay.
references.
Okay.
And another thing is then how did you correlate? I mean, how did you get the idea of correlating these two? Yeah, that has to come, isn't it?
Okay, sir.
From your study, it is evident there is a relation,
Yes, sir.
isn't it? And burnout is talked about in what kind of professions? The exposure is important. How many years of exposure?
Yes, sir.
Isn't it? PGs have hardly 3 years of exposure. And if a person doesn't succeed in passing, maybe 1 more year. Isn't it? Is that enough to cause burnout? Because burnout is caused by prolonged exposure to monotonous kind of a work and monotonous same results, not expecting much, like chronic rehabilitation centers, terminal illnesses, isn't it? Yeah. So because I was surprised how there can be burnout in PGs, postgraduates.
What is the definition of burnout that you use?
I don't. Thank you, sir.
Thank you, Dr. Kirtana. Next, Dr.
Good morning, everyone. Myself, Dr. Padmasha, second year postgraduate from KIMS Medical College, Amlapuram. Today, I am going to present about the paper conducted in our setting. The title of our paper is A Cross-Sectional Study to Explore the Adverse Childhood Experiences with Academic Performance Among Medical Graduates. Coming to the introduction. Adverse childhood experience is an intense feeling of stress and unhappiness, which include experience such as physical or emotional abuse, neglect, assault, or betrayal. It can manifest as a heightened emotional reactivity, difficulty in managing emotions, or even emotional numbness as a coping mechanism in some. During childhood, it can lead to far-reaching consequences on child's emotional development, attachment style, and belief system, causing emotional hesitation and difficulty in forming secure attachments and challenges. Exposure to childhood trauma is measured by adverse childhood experience associated with increased risk of mental health challenges. The importance of early prevention and intervention to promote a healthier outcome for individuals who have experienced trauma during their childhood. Academic performance comprises of a wide range of factors, including personal attributes such as cognitive abilities, emotional intelligence, motivation, resilience, study habits, and other external factors. The reason why I chose medical course is it's a demanding academic pathway and mostly focus on problem-based learning. And it has it requires qualities like focus, mental acuity, and emotional stability, and can be severely compromised by early life trauma. The traumatic events that arouse from childhood memories can disrupt cognitive functions and impair concentration, and can create a profound impact on students' academic achievement and overall well-being. Coming to the methodology. The aim of my study is to explore the adverse childhood experiences with academic performance among medical graduates. It's a cross-sectional study, and the study setting is used only online Google Forms distributed through various social media platforms. This is my sample size and my sample size formula for getting the sample size. And study subjects are medical graduates, and inclusion criteria all individuals who are in medical course, and exclusion of presence of psychotic illness or presence of any serious physical illness. The study duration is 1 year from ISC approval, and the questionnaire used are semi-structured socio-demographic details, adverse childhood experience scale, and academic performance scale. The statistics we used are R language. Coming to the results, this is a table 1 showing socio-demographic details of the participant. The mean age of the participant is 22.4, with majority of female, and most of them are single, and major are doing MBBS, hailing from urban, and mostly entered the medical school through merit based and belonging to nuclear family. And table 2 shows the comparison of adverse childhood experience and academic performance with participant sex. In this table, we use the test called Kruskal-Wallis test, and we found that there is no significant association between the adverse childhood experiences among the participant sex and academic performance. But however, we found the significant association of females faring far better than males in academic performance. This is the table 3 showing the correlation between the ACE and its domains with academic performance scale. In this table, we correlated the entire ACE score with APS score and individual domains of ACE like abuse domain, family domain, parents domain and violence domain with the academic performance score. But we found that there is no significant association, and test used for this correlation is Spearman correlation. And the table 4 shows the comparison of academic performance scale with other academic details. In this, we found the statistical significance of based on the academic behavior, like the number of distinctions were more than 2 and number of hours spent on the social media is less than 2 hours with the average sleep period of 6 to 8 hours, and no supplementary examinations have good academic behavior and have the good APS score. Coming to the discussion. According to study conducted by Andres F. Scoyer et al., the higher the score of ACE, it results in more prevalence for burnout, resulting in poor academic performance. But our study is counterintuitive to find the showing that there is no significant association between ACE and academic performance. This may be due to several factors. Firstly, resilience, which play a crucial role in masking the impact of the ACE. Resilience is defined as a capacity to recover from stress and adapt to challenging circumstances, and is influenced by a combination of different factors like personal, environmental and genetic factors. Apart from this, individual temperament and coping strategies can significantly enhance, and other elements such as in medical course we have the strong social networks and access to mental health resources. So it can play a crucial role in supporting resilience and help in shielding against the negative impact of ACE. The relationship with teachers, parents and friends help individuals to manage stress effectively and enhance emotional stability, providing coping strategies and offer security. This support to network can reveal adverse effects caused by stress and promote better emotional and psychological well-being. Secondly, the impact of genetic and epigenetic factors. We only recorded ACE scores of students. So to understand the potential epigenetic effects, we should also record the parents and grandparents' ACS score and determine whether high ACS score in earlier generation contribute to elevated in subsequent generation. Thirdly, bias, which pose a major problem in cross-sectional study, and most of the ACE contains sensitive and confidential questions. It may be affected by external factors causing social desirability bias. And other factors such as physical activity and parenting practices can also influence the stress response system. And it might be in our study we found no significant correlation, but we found the females perform better in academics than males, which might lead to difference in perception and cognitive processing. Limitations of the study are the diversity of the sample limits the generalizability of the study, as the study only limited to the medical course, so it difficult to generalize the result. And self-reported data results in potential bias causing over-reporting or under-reporting of ACE. And the study mainly focus on examination of association or correlation, but it does not establish the causal relationship. Cross-sectional as is a cross-sectional methodology, it only gives a brief moment in time, limiting the capacity to draw connection between variables or analyze the long-term consequences. And this study did not fully examine the influence of socio-cultural factors. And this limitation should be acknowledged as they impact the comprehensiveness and applicability of study conclusion. The strengths of my study are, one among the few studies conducted in India, and most of the studies show negative correlation, but our study show no association, knowing more about the concepts of resilience and positive impact of socio-economic and cultural factors. Conclusion. The study did not reveal the direct link between ACE and academic performance, but there is a strong connection between academic behavior and performance, emphasizing the role of study habits and lifestyle choices. It is essential to further explore this relationship and develop effective strategies to support students in managing their current academic responsibility alongside of their past experience, thereby enhancing their overall academic performance and well-being. These are my references. Thank you.
Just want to see the references.
Yes, sir.
Yes, please.